make sure you have proper privacy. My name is Sydney. I'm a nursing student at Oakland University, and I'll be taking care of you today. I'm just going to be assessing your neurological and musculoskeletal systems, okay? And now I'm just going to be performing proper hand hygiene just to make sure everything is nice and clean for you. And I'm just going to check your level of consciousness now, so please state your first and last name. Okay, and where are you today? And what's the date?
November 14th.
And what brings you in?
An assessment.
Okay, I'm standing here with Grodsinsky, who is alert and oriented ×4. Now I'm just going to be checking for pertinent history. So do you have any history of any traumas?
No.
Any history of any falls?
No.
Any history of any head injuries?
No.
And any problems with your eyes?
No.
Okay. And now I am just going to be asking you a few more questions with the subjective assessment. So would you please tell me, do you have any joint pain?
No.
Any muscle pain?
No.
Any weakness?
No.
Any numbness or tingling?
No.
Okay. And now I'm going to move into the neurological assessment. I will be assessing cranial nerve 3, oculomotor, cranial nerve 4, which is trochlear, and cranial nerve 6, which is abducens. So first, I'm just going to be looking at your pupil sizes, which they appear, both the right and left appears to be a 3. And they are round and symmetrical in shape. The pupils are equal. Now I'm just going to turn the light off because I'm going to be checking for reactivity. So now I'm looking at the right eye. The direct response constricts to a 2. And now the consensual response of the left eye constricts as well. And now I'm going to be checking direct response of the left eye. It constricts to a 2. And now the consensual response of the right eye constricts as well. So now I'm just turning the light back on. I'm going to be checking for accommodation. So would you please look at that door over there for me? Good. And then look back at my pen light. And good. Good. The eyes converge, and my patient has demonstrated Perla in the eye assessment. So now I'm going to be checking for cardinal positions of gaze. So would you please look at my pen light again? Good. Good. My patient has completed the cardinal positions of gaze. And now I'm going to go into cranial nerve 5, which is the trigeminal nerve. I'm just going to be palpating the masseter muscle, so please open your mouth for me. Good, and close it, and clench your teeth. Good. Cranial nerve 5 is intact. Now cranial nerve 7, which is the facial nerve. I'm going to have you please smile for me. Good. And now raise your eyebrows for me. And now squint. Good. And now I'm going to have you puff out your cheeks for me. Good. Cranial nerve 7 is intact. And now I'm going to go on to cranial nerve 11, which is the spinal accessory nerve. So please shrug your shoulders for me. Good. And cranial nerve 12, which is the hypoglossal nerve. Can you please stick out your tongue for me? Good. The tongue is midline. And now I'm going to check cerebellar function. So would you please place your hands on your lap? Good. And then flip them back and over like this. Good. Okay, and now hold your palms out for me. Good. There are no extra abnormal movements or tremors when the patient has completed rapid alternating movements. Now I'm going to go into the musculoskeletal assessment, and I'm going to first begin by assessing the shoulders. The color is uniform and symmetric without the rest of the body. They are symmetric to each other. Now I'm palpating for temperature, which is warm to touch. Let me know if you have any tenderness, okay? No tenderness, okay? And now I'm just going to be checking range of motion, so would you please bring your arms up like this? Good, and then up to the ceiling, that's flexion, and back down, and then down to the ground, that's extension. Now I'm going to have you bring your arms to the side, and up, that's abduction, back to the side, and down, that's adduction. And now I'm going to have you bring them up to the side again. We're going to move in a circular motion. Good, and then in the opposite direction. Good, that's external rotation. There is full range of motion in the shoulders. Now I'm going to move to the elbows. I'm first just going to begin by inspecting. The color is uniform with the rest of the body. There's no swelling or edema. And I'm just going to palpate. Let me know if there's any tenderness, okay? No tenderness. Now I'm just going to check range of motion. So bring your arms up like this again and bend in a muscle position. That's flexion, back down, extension. Good. Now bring your palms up like this, supination, and down, pronation. Now I'm just going to begin by checking muscle strength again. So bring your arms back in the muscle position. Now, good. Push against me. Good. And pull against me. Okay, now push. Good. And pull against me. Good. So the elbows have full range of motion and the muscle strength is a 5. Now I'm just going to begin by assessing and inspecting the hands and the wrists. The color is symmetric with the rest of the body, and there's no swelling or edema. Let me know if you have any tenderness. No. No tenderness. Good. Okay, and now I'm just going to be checking for range of motion. So if you would please bring your bend your wrists and put your fingers up like this. Good. That is wrist flexion and back down, wrist extension. Now bring your palms up like this and make a fist for me. That is finger flexion and back down, extension. Now can you bring your fingers apart for me like this? Abduction and together, adduction. So now I'm just going to be checking grip strength. So grab my hands and squeeze tight. Good. The grip strength is symmetric in both hands. And now I'm just going to be checking capillary refill. There's nail polish on the nails, so I'm checking the fingertips. Good. Good. And color return within 3 seconds. And now I'm just going to be feeling the radial pulses. The rhythm is regular and the grade is a 2. Now I'm feeling the brachial pulses. Good. Rhythm is regular. The grade is about a 2. So now there's full range of motion in the wrists and the hands. And now I'm just going to I'm going to ask you to please lay down, which is in the supine position. Good. And I'm just going to be inspecting your hips. Your iliac crests are symmetric and the lower legs are aligned. I see no swelling in the knees or swelling or edema in the knees or the ankles. And I'm just going to palpate for tenderness, so let me know if you have any tenderness in the hips.
No.
Okay. Any tenderness in the knees?
No.
And what about the ankles?
No.
Okay. Now I'm just going to be checking for edema. So I'm just feeling here. Good. Good. There's no pretibial edema. Now I'm just going to be checking capillary refill. Again, there's nail polish on the toes, so I'm looking on tips of them. Good. The capillary refill return, the color return within 3 seconds. Now I'm just going to be checking the dorsalis pedis pulse. The rhythm is regular. The grade is about a 2. And now I'm feeling the posterior tibial pulses, which is the rhythm is regular. The grade of about a 2. So now I'm just going to be checking range of motion. So would you please bring your right knee to your chest for me? Good, and back down. And left knee to your chest for me. Good, and back down. That is knee and hip flexion and extension. There's full range of motion in, would you please bring your right leg outwards for me, like to the side? That's abduction and back, adduction. And now your left out to the side and back in. Good. There's full range of motion in the lower extremities. Now if you please sit back up for me. Thank you. Okay. So now I'm just going to be checking muscle strength. So if you please raise your right leg for me, just your knee up, good, like that. Okay, now don't let me push you down, good. And now other one, don't let me push you down, good. And now just kick your leg out a little bit, your right leg, perfect. Now don't let me, or pull against me, good. Don't let me push you in, good. And now other one, don't let me push, yep, and don't let me push, good. The muscle strength is a 5 in the knees and the hips. And now I'm just going to be checking for range of motion in your ankles, okay? So would you please point your toes for me? Good, and then that is plantar flexion, and then bring your toes up for me. That is dorsiflexion. And now and then bring your toes inward for me. That's inversion, and then outward, eversion. Now I'm just going to be checking for muscle strength again, so push against me like you're pressing on the gas. Good. And then toes to your nose. Good. So there's full range of motion in the sitting position, and the muscle strength is a 5. And now I am just going to please ask you to stand for me, okay? I'm going to be assessing your spine, so please turn around for me. Good. Okay, I'm just going to lift your shirt up, and I'm assessing your spine. Good. The spine is midline and straight. The scapula are symmetric, and the cervical is concave. The thoracic is convex. Lumbar is concave, and sacral is convex. And now I'm just going to be palpating the spinous processes. So let me know if you have any tenderness, okay?
No.
No tenderness here?
No.
Okay. What about any tenderness down here?
No.
Okay. So the patient has no tenderness. Now I'm just going to be checking for range of motion. So if you would please bend down and touch your toes for me, okay? Good. And then back up. And now I'm just going to have you rotate to the right like this for me. Good. And then back. And before that was flexion and extension. This is rotation. And now I'm going to have you laterally bend to the right for me. Good. And now to the left, laterally bend. Good. That's lateral bending. And now I am just going to have you walk out a little bit for me. Good. And then walk back. Good. The patient has a smooth and even gait and full range of motion. Now you can sit back down for me. So now I'm just going to be performing proper hand hygiene, and I just wanted to let you know that that's the end of the assessment, and I just wanted to thank you for your time. So thank you.